Usually cough, which is acute in nature, can be associated with a viral illness. But if it goes beyond 3 weeks, then it can be something more than that. It would be worth getting a checkup, especially if this is associated with any chest pain every time you breathe or you cough. If there is having purulent or discolored phlegm or somebody's coughing up blood with that, that's for more serious nature probably. Then if someone is getting more breathless with coughing, getting chest tightness or wheezing, that can be indicative of any underlying lung disease. And if there is a history of fever, weight loss or night sweats, that might be indicative of some ongoing infection which may need further investigations.